Hello, my name is Papach, and I'm going to be speaking to you about psychological interviews. Specifically, I wanted to speak about child crisis interviews for a number of reasons. Very interested in the subject, but for over 7 years, I worked at a psychiatric treatment facility for adolescents. In which case, one of my roles was a trainer, and I taught our incoming staff and various other departments on verbal de-escalation and behavior management. So I thought I'd be able to give you a little bit of professional perspective on this specific type of interview. So what we'll be doing is we're going to go over the importance of guidelines when it comes to a structured professional interview. We're going to talk about professionalism in regards to conducting that interview. We're going to talk about verbal and nonverbal communication during that interview. We're also going to talk about the do's and don'ts of questioning, and then we're going to talk about follow-up questions and the certain kind of responses you can use to elicit more information. So to begin with, following guidelines, Thaker and others talk about the importance of increasing uniformity when you're giving certain types of interviews. The reason for this is because you can have reliability across multiple interviewers. When you have multiple people conducting interviews the exact same way, you're going to get a lot more consistent results. It's important that another guideline that you would follow is to remain objective and to have control. Mainly for this aspect is so you can focus the conversation on the type of information that you want to get. These are still guidelines, and reason for that is it does allow for personal application. When I taught verbal de-escalation, we talked about working styles in your interactions, whether you are charismatic or you are very client-focused. There's different ways to go about different situations, and they are situational, when and where and how you use the different skills. It's appropriate to use them in different times, and those who are very good at especially de-escalation could master these different working styles and apply them at the right times in the right situations. So professionalism, we talk about empathy being a key motivator here. Empathy, as defined by the Department of Children and Families in the state of Florida, is a process in which you attempt to experience another person's world and then communicate an understanding of and compassion for the person's experience. So it's basically understanding another person's shoes, being able to act based on how somebody else feels in a certain situation. Empathy is everything when it comes to working with people in crisis. When somebody feels that you understand them and their plight and their situation, you're much more likely to gain conversation. You're much more likely to gain success in that interaction. Respect is another important aspect. How would you like to be treated in a given situation? And this goes a little bit further than treat others the way you would like to be treated, but specifically treat others the way you would like to be treated given a specific situation. If you were in that situation, or if you were a victim of abuse or a victim of a crisis situation, how would you like somebody to speak to you during that event or just after that event? Really puts things in perspective. Lastly, genuinity. It's very important that you relay to somebody that you are real and you actually have an authentic concern for how they feel and what's going on with them. If you are just going about your business and you're acting like it's just a job and you're just there to collect a paycheck, clients definitely know that. They can pick up on that very quickly, and they will often close up, maybe even become defensive. Especially in crisis-related situations. They're looking for somebody to care about their situation. It is the natural response during crisis to do that. And if you do not look like you care, they're not going to want to share that information with you. Next, we're going to talk about verbal and nonverbal communication. So first, verbal cues. We're talking about open and closed questions. Cohen and Swerdick talk about open and closed questions. Open questions being more broad answers that you can give. So for example, how are you doing today? Fine, I'm well. What did you do today? Open, right? You can talk about anything. Closed questions are usually yes or no questions, but give very finite responses. You don't really have an opportunity to expand upon that. So for example, did you eat today, right? Was his shirt red or blue, right? Those are closed-ended questions. You don't have a lot of opportunity to expound upon it. It's important to understand that when working with children in crisis situations that you use open-ended and closed-ended questions appropriately. Sometimes if you can't get somebody to talk, closed-ended questions are a little bit easier because it's easier to answer a closed-ended question. What happened might be too much to comprehend in a crisis situation, but if you say, are you hurt? Yes or no, that might be easier to answer, and then you can draw out more from there. However, when just processing an interview, for example, after a crisis situation. Open-ended questions are great for children because it allows them to give you all of the information they know, especially like in a witness testimony and things like that. You do want to be careful. Sederberg and others did say that young children's responses to open-ended questions can often be modified. They will change what they're going to say because they want to relay and communicate to you and help you understand what they're trying to say. But they're also highly susceptible to suggestibility. So you want to be very careful when you're leading them on that conversation, that you're not giving them anything that they can use to manipulate their story, modify their story, and make it false. Unfortunately, in a lot of situations, Sederborg also stated that police don't often use open-ended questions. They use very directed questions, and unfortunately that can cause a lot of misled children who give other answers. If you do not allow them to expound upon their own ideas and talk through them, even if you're not completely understanding, you might gain something by allowing them to talk through their whole situation before you interject and give them direct questions. So with children, it is important that you do have open-ended mindset to start with. The other thing we'll talk about is active listening. One of the things from a professional perspective that I taught was active listening, and what that means is engaging in conversation actively. You can listen to your radio in the car, and you could be having a conversation with the person in the passenger seat. You can be thinking about something else. You could be rolling your window up and down. Either way, hopefully paying attention to driving. That's just listening. Active listening is participating in listening, right? So you want to maintain that eye contact, look at somebody. If they say something, you want to give approving verbal cues like, yes, go on, right? Maybe even ask questions and get involved. You want to be certain that you're giving them your full attention actively. If you're on your phone or not looking at them or trying to do 10 other things, they're going to get a feeling that you're not paying attention to them and what they have to say is not important, in which case they're probably going to stop talking to you. Next, we'll talk about nonverbal communication. Important thing to remember here, body language. We talk about eye contact, said that before during active listening. Show somebody that it looks like you're paying attention to what they say. Your facial expression is very important. We talk about what you're looking like when they're looking at you and they might be pouring out their heart about something. And if you're giving them a weird or confused look, they're going to make them feel a little bit more apprehensive about sharing with you. We talk about height and personal space. I'm a taller guy, and if I can be imposing in certain situations, personal space is very important, especially for children and especially for somebody who's been through crisis or is currently in crisis. Thaker and others say that you should sit if you can. However, if you can't, and there's a lot of reasons for this, specifically where I worked, we had aggressive patients. You don't necessarily want to leave yourself susceptible to a physical attack, so standing is always preferable, but you do want to stand close enough to express concern, but also far enough back to avoid being threatening. So you do want to be close enough that it looks like you care, you're concerned, but you also want to make sure you give yourself distance, especially somebody who is a victim of abuse or assault, especially sexual abuse. You do want to be careful about getting in their quote-unquote bubble, right? Hand gestures are very important to understand, especially somebody who's been through abuse. If you're going to approach somebody, it's very important that we say palms towards yourself. As soon as you put your palm out towards somebody, it looks like you're going to touch them, and they can be very agitated by that. We say keep palms towards yourself. Avoid pointing aggressively and things like that when you're redirecting or talking to somebody. Posture is very important. How you're standing. Do you have that angry dad kind of stance when you're talking to somebody? Do you have a professional concern? We used to talk about a look of professional concern, kind of like I'm looking, helps if you have a beard, I guess, but I'm paying attention to what you have to say, and I'm listening to what's important, and what you're saying is very important. So posture is very important as well. A third aspect here that we used to talk about is paraverbal communication. So nonverbal and paraverbal communication. About 90% of communication takes place through body language and paraverbal communication. So you might say, what is paraverbal communication? So verbal is what you say, and paraverbal is how you say it, right? So you can just tell by this image here, the body language that's being displayed here, that this person just appears to be very angry, and that's body language, right? Paraverbal communication is a lot to do with your tone, how loud you're saying something and how you're saying it. So I can say, why don't you come over here and sit down? Or I could say, why don't you come over here and sit down, right? I use the exact same verbal communication, but my paraverbal communication was very different, right? your rate of speech, how quickly you're saying something to someone, and especially a child. You want to make sure that you're conveying it in a way that they understand, that's on their level. And then timing. Sometimes clients don't always want to respond right away, or maybe they're taking time to think. And if you're hitting them with rapid fire question after question, they may become frustrated or not want to answer your questions. So you don't want to give them time to appropriately respond if they can. Follow-up questions. We talk about reflecting responses, reflective responses. Follow-up questions are when you get a little bit of information, your next response, right? How do you handle that information? Reflective responses are a great way to dig deeper into a situation. Oftentimes we talked about the patients I worked with, if they would give you a little bit of piece of information, especially during crisis when they're just verbally venting and we used to call it word vomit. They're just throwing a bunch of it all over the place, and it might not be in any kind of particular order necessarily, but you draw it a little bit at a time, and then you ask a question about it. So for instance, you used to have a client say, I was talking to my mom on the phone and she said this and this and this and this, and you might say, okay, did you make a call or did your mom call you, right? That does two things. One, you're getting a little bit more information about the context of the story, but two, it also shows the client that you're listening to what they say, because they gave you a little bit of information and you asked about that, and then you're able to dig a little bit further, and it reassures that patient or that client that you are listening. Thaker and others do talk about reflecting the linguistic abilities of the child. You want to make sure that you stay on their level. For multiple reasons, clarity for one, and communication. You want them to be able to communicate within their own words. And if you try to summarize things and bring in new words, especially we're very tempted in the field within our within psychology and the study, right, to want to interject our words and use the professional words that we know and maybe impress somebody. But if you're working with a child and you say a new word that they don't understand, they may adopt that word and continue to use it throughout the interview without actually knowing what it means. Or maybe other times you might presuppose things and suggest things, right? So you want to avoid offering these possible answers. So I can say, how did you feel about that? It's an open-ended question, gives them the chance to tell me how they feel through their perspective. But if I jump ahead and say, were you frustrated? And they say, yeah, I was definitely frustrated. Well, were they frustrated? Maybe they were scared. Maybe they were hurt. Maybe it wasn't quite frustration. But because we suggested that word as an answer, they might adopt it and use it. This is especially true for children. So you do want to be careful with offering up those possible suggestions. Lastly, we'll talk about the do's and don'ts of conducting verbal interviews and what kind of things you should do and shouldn't do throughout the course of a conversation, especially in this context of our focus of crisis-related interviews. Always actively listen, pay attention, be engaged. Put aside your own feelings. This is very important, especially with escalated patients. They might be aggressive, they might be defensive, they might say things that might be hurtful to you. You have to make sure you use that professionalism and your sense of empathy and understand that 9 times out of 10 it's not you that they're upset with, it's their current situation. So you want to make sure you put aside your own feelings and you are professional. Facts versus feelings is very important, especially for children and adolescents in crisis. The patient I was talking about earlier would say, my mom hates me, and I can reflect on that and say, well, did she say she hates you, or is that something you're saying on your own? Did you come up with that? How do you know she hates you, right? Being able to understand where those feelings are coming from. Is she hurt, frustrated, and scared? Is that why she's saying that? Or did her mother come out and actually say she hates you, right? Gathering those facts help you put the whole story into context and helps for a more reliable interview. Lastly, reflecting the verbal and the nonverbal. This is very important to pay attention to during an interview process. Maybe there are things you want to talk about, but maybe it's not the time to talk about, or maybe there are things that the patient does not want to talk about, but it is the time to address. And you can notice certain behavioral cues, verbal and nonverbal. They might tense up or grit their teeth or their fist balls up. These are things that you want to pay attention to so that you know how to react appropriately, whether you want to address this issue further or maybe wait for another time. The nevers here are the do nots when you're working with situations. Do not take ownership of a problem, especially working with people in crisis. Oftentimes you feel this need to jump in and say, well, I'll take care of that for you. And especially people in treatment situations. You know, crisis out in the real world has different implications, but in treatment situations, you want to be able to teach people how to handle their own issues. And if you always come into a crisis and say, well, I'll take care of that for you, just calm down, you know, the response going forward is, well, all I have to do is go into crisis mode and somebody will come in and take care of me. And that's not real life. So you definitely want to, you know, talk to them about how they can handle their situation appropriately. Secondly, do not be judgmental. You do not want to pass judgment on somebody. As soon as somebody feels like you're judging them, their thoughts, their feelings, or their actions, they oftentimes will just hole up and stop talking. They might become defensive and angry with you. So you definitely want to maintain that objective, just listening aspect. Do not criticize or minimize feelings. Oftentimes, clients feel certain kinds of way that might be interesting or maybe even disturbing to you. Maybe it just doesn't make sense. Sometimes we have patients, especially teenagers, they have a lot of care about how they look in certain situations. I had patients very upset that they scuffed their shoe, right? And it wasn't my place to say, well, it's just a scuffed shoe, get over it, it's not that big of a deal. To them, it is a big deal, and you have to validate that concern and show that empathetic nature. Do not assume or ignore specific requests. Assuming things is always bad for a person in context. You might have worked with what you figure to be a very typical patient over and over and over again, but every one client's perspectives and experiences are different, and you want to make sure that you're giving them that respect and that ability to vent out their frustrations, and you might, you know, discover something new about them. So you want to give that patience and that time, and also specific requests. You want to acknowledge specific requests. You know, if you have a client say, I have to go to the bathroom, you're not going to reply, well, how do you feel about having to go to the bathroom? You know, you say, oh, well, the bathroom is right there, right? So you want to attend to specific requests, you know, especially to somebody who is in crisis, so you can address those situations appropriately and move forward. Well, that's the end of the presentation. I hope you enjoyed it, and if you have any questions, feel free to reach out. Thank you very much, and have a great day.